Patients are very scared when they first hear the word cancer. They are fighting for their life, and they really don't have time to think about all of the details that may come up or the barriers that may arise as they're trying to receive care and or go through their treatments. They're sick, they don't feel good, and they need an advocate. They need someone that can help them understand what they might need. Patient navigators help patients understand their diagnosis and their next steps so they can move forward. Breast cancer patients in particular, their needs are complex depending on their diagnosis. Who do they need to see first? Do they need a breast surgeon? Do they need a medical oncologist? Do they need a radiation oncologist? Maybe they need all three.
We definitely want to make sure that patients can stay on track and don't feel like they're lost in this big system. We want to make sure that they have a go-to person that's right by their side that they can lean on at any time. The patients may not be aware of all these different resources as far as the genetic counselor that's here, the radiation doctor and the physical therapist. They may need some support from other breast cancer survivors themselves who may be able to give them a hand or somewhere to lean on. And I think having that patient navigator can be a very helpful resource.
Every cancer patient that comes through this center should be connected with a navigator, and that should be early. We want to help patients before there's a crisis. With Crystal, we connected early on during her initial diagnosis, and she truly didn't know what a patient navigator could help her with.
The first time my nurse navigator called me, we talked for about an hour. She told me about the different resources that they have and the resources that they have for kids. If I have a question, I can call. It just makes life a lot easier, especially after my treatments, because those are really hard. And chemo brain is real. Chemo brain is real. It's a real thing. It's a very real thing because I cannot remember a lot of stuff. And she helps me the best way that she knows how. If everyone was able to have a nurse navigator, it will make it a lot easier.
The biggest resource that we don't have more of is time. And so having more people and staff on hand to dedicate time to each patient is so valuable because this is a big diagnosis with lots of information.
Patient navigation and all of our resources are a free service to patients. Currently, we have 2 nurse navigators at the Dallas campus, and on average, we see anywhere from 5,000 to 6,000 plus patients a year. My hope for the future is that every breast cancer patient is connected with a patient navigator and that we can grow the navigation program in leaps and bounds and provide support both inpatient and outpatient.
We're trying to take something that's a very stressful time and experience and just lighten your load by giving you the necessary resources and support that you need.
My nurse navigator is my Baylor nurse navigator best friend because I can talk to her about any and everything. It makes my journey dealing with this a lot better. I'm not by myself. I have to do this because this person is rooting for me. This person is here for me.